I'm Andrei Calin. I'd like to invite you to spend the next few minutes talking around the subject of arthritis with my guest, Dr. Andrei Calin, who's a consultant rheumatologist at the Royal National Hospital for Rheumatic Diseases in Bath. Now, I was staggered to learn recently that 5 million people suffer from arthritis in Britain. That's nearly a tenth of the population. And I expect many of you listening either suffer from arthritis yourself or know someone close to you that does. Now, later in the program, I'll give you the address of the organization dedicated to the arthritis sufferer, Arthritis Care. So, get a pen and a piece of paper handy, please. Now, I'm taking this opportunity to find the answers to some of those questions which we have all wanted to ask. Can I be cured of arthritis? Will I become disabled? And perhaps, most importantly, what should I know about the medicines my doctor prescribes? I mean, we hear so many different things about arthritis from our friends and relatives. A miracle cure for arthritis, the occasional scare story about medicines in newspapers and magazines. Really, it's sometimes hard to know where to go to get the truth. Well, to get the right answers, of course, you've got to talk to an expert. And I'm pleased to welcome Dr. Andrei Calin here today. Welcome, Andrei.
Barbara, thank you. You're absolutely right. There's a tremendous amount of confusion, and what I hope we'll be able to do over the next few minutes is to look at some of the questions that patients are always asking and try and provide the answers.
Okay, Andrei. Here's a question I think everybody would like to know the answer to, and that is whether all arthritis sufferers become disabled.
Barbara, the answer to that is easy. No. The vast majority do not. The vast majority of patients can lead a virtually normal life from the point of view of their personal activities, their family life, their jobs, and so on. One of the problems is patients come to the hospital, will see people in a wheelchair, for example, and they automatically think that they too are going to end up.
Are we recording? I believe we are. 5 seconds. Well, hello and welcome to Eccles... Do it again. Well, hello and welcome to Eccles Local Radio. Today we've got an interview with a doctor about arthritis care. Now, some of the contact details have changed since this recording was made, and I'll give you the new details at the end of the programme.
I'm Barbara Calin. I'd like to invite you to spend the next few minutes talking around the subject of arthritis with my guest, Dr. Andrei Calin, who's a consultant rheumatologist at the Royal National Hospital for Rheumatic Diseases in Bath. Now, I was staggered to learn recently that 5 million people suffer from arthritis in Britain. That's nearly a tenth of the population. And I expect many of you listening either suffer from arthritis yourself or know someone close to you that does. Now, later in the program, I'll give you the address of the organization dedicated to the arthritis sufferer, Arthritis Care. So, get a pen and a piece of paper handy, please. Now, I'm taking this opportunity to find the answers to some of those questions which we have all wanted to ask. Can I be cured of arthritis? Will I become disabled? And perhaps, most importantly, what should I know about the medicines my doctor prescribes? I mean, we hear so many different things about arthritis from our friends and relatives. A miracle cure for arthritis, the occasional scare story about medicines in newspapers and magazines. Really, it's sometimes hard to know where to go to get the truth. Well, to get the right answers, of course, you've got to talk to an expert. And I'm pleased to welcome Dr. Andrei Calin here today. Welcome, Andrei.
Barbara, thank you. You're absolutely right. There's a tremendous amount of confusion, and what I hope we'll be able to do over the next few minutes is to look at some of the questions that patients are always asking and try and provide the answers.
Okay, Andrei. Here's a question I think everybody would like to know the answer to, and that is whether all arthritis sufferers become disabled.
Barbara, the answer to that is easy. No. The vast majority do not. The vast majority of patients can lead a virtually normal life from the point of view of their personal activities, their family life, their jobs, and so on. One of the problems is patients come to the hospital, will see people in a wheelchair, for example, and they automatically think that they too are going to end up like that. But let me stress that there are at least 200 different forms of arthritis, and the vast majority of people will do very well. Now, I think most people listening will have degenerative joint disease, also called osteoarthritis, which is the commonest form of arthritis. But you mentioned 5 million people. Now, at least 90%, particularly those who are over the age of 50 or 60, if they have arthritis, it will be this common degenerative type. Another very well-known form of arthritis is rheumatoid arthritis. And it's very important for people to know which of those two, or indeed any of the others, they have, because the treatment is completely different, the long-term outcome is completely different, and the more information the individual has about his or her own form of arthritis, the better they can understand what the outlook is likely to be.
Okay. Now another question. Can arthritis be cured?
And the answer is, very simply, yes or no, depending which forms we're talking about. Now, one type we didn't discuss, fairly rare, is due to an infection. If you have a bug that gets into the joint causing arthritis, that can very readily be cured with an antibiotic. If, on the other hand, you're talking about degenerative joint disease or osteoarthritis that cannot be cured as such, the actual damage in the joint can't completely be stopped, but nevertheless, the symptoms can very often be got rid of, more or less completely. Then another fairly common form of arthritis, such as gout. Although the actual internal problem in the body causing the gout can't be cured, we can almost always prevent the acute joint attacks happening. So from the patient's point of view, they're virtually cured.
Now, are there drugs for obviously different types of arthritis?
Absolutely right. And they perhaps form the main attack that we have against the joint symptoms or the joint problems. It's very important, though, that when we first have contact with the patient, that they realize that it isn't only or simply a question of drugs. We have to take a much broader approach than that. First of all, education. The more insight the patient has, the better, for the reasons we've touched on. The patient must know that the drug may be given just to get rid in the early stages of the pain and stiffness, and thereafter the mainstay may perhaps not be drugs, but maybe exercise. For example, if you take the big muscle on top of the knee, and the knee becomes painful and inflamed, the medication may be very good for the knee, but unless we also direct the patient's attention to building up the strength of the muscle above the knee, then the knee will continue to give a problem. So we need a broad approach to each specific form of arthritis in each specific type of patient.
I, like you, and I'm sure everybody else, have read some newspaper reports on the side effects of drugs for arthritis. Now, should we take any notice of that kind of story, Andrei?
Well, I think we have to take notice because the news is there and patients are frightened and doctors can be bewildered. It's a very big issue and it's rather sad. As you, of course, appreciate, that papers, they're sold by having dramatic events reported. Of course, good news is no news, and it's only bad news that gets reported, and usually out of context with reality. And it's very disappointing. It's very difficult to maintain one's confidence in even good newspapers when we read some of the material that gets in, particularly dealing with medicine and drugs specifically. So I think that all we can do is advise the reader that much, if not most, of what he or she reads is quite frankly nothing to do with the truth. And they will have to go to the general practitioner and get more information. But it's equally difficult for the doctors because information gets around, but it's difficult to do so quickly, and it's only the newspapers that can get to the masses immediately, and that's where the problem lies.
Yeah. Okay, to change the subject just a bit, what should patients look out for when taking these drugs, and what should they do if they notice anything unusual?
That's a good question. I think the first thing is that any doctor who writes a prescription for a patient will always, or should always, let them know that every medication can carry a small, often very small risk of side effects, and we must discuss those risks in the same way that we will tell the patients about the potential benefit, what we expect the medication to do for them, the good things. We will also warn them that perhaps 1 in 100 cases or 1 in 1,000 cases or whatever the number is may develop side effects. And that could be, for example, and commonly, to the lining of the stomach, and that's something we're concerned about. It can be skin rashes. Other anti-arthritis medicines can cause headache, and so on. So we warn them about these rather more common, but remember, even when I say common, I'm talking perhaps 1 in 100 or 1 in 500 individuals, really. We warn them about that. And the second part of your question, what should the patient do if they notice something unusual? Very simply, they must go back to the general practitioner and ask. And we always tell our patients that whenever they go to a doctor, they might be away on holiday, if they go to a doctor with a problem, always let the doctor know what medications they're on, because it's just possible that the problem they have relates to one of the tablets that they're taking.
Yeah, fair enough. Okay, now, what improvements can a sufferer expect from taking these pills?
Well, first of all, I think the easiest way of looking at that is let's start off with the night. Many people with different forms of arthritis find that they wake up during the night with pain. And of course, one thing that these tablets can do is get rid, to a large degree, of the pain. And it's worth stressing here, perhaps, that the anti-arthritis medications we're giving are not what we would call simple pain-killing tablets. The pain-killing aspect is secondary to their anti-inflammation properties. So, although the pain is less during the night, and they will therefore sleep better during the night and feel better in the day, one of the main advantages of these tablets is it will decrease the stiffness. And patients with most forms of arthritis know that they are often worse in the morning. What would take you or me 10 minutes to do in the morning might take the arthritis sufferer half an hour or longer because of this stiffness and difficulty in getting about early on. And these tablets are very good at decreasing the stiffness. Then, of course, there's the increasing pain and stiffness that one can get just after sitting down for a few moments. The knees can stiffen up. And this sort of difficulty would be lessened with the anti-arthritis tablets.
Right, Andrei. Now, can you say, and I know this is difficult to answer, but can you say how often and how long will patients have to take their pills for arthritis?
Again, Barbara, to stress the point, there are so many different forms of arthritis. Some forms of arthritis, for example, the difficulty patients get with a stiff, painful shoulder, or the so-called tennis elbow, and so on. The problem with the heart is a heart disease, or kidney is kidney disease. We're talking here about joint disease.
Oh, fair enough. Now, these pills that you're talking about that are so helpful, or hopefully helpful, can they be bought from the chemist, Andrei?
There are so-called anti-inflammatory agents that can be bought from the chemist, and for one, for example, has always been available over the counter from the chemist, and that's aspirin. Over the last 2 or 3 years, a newer non-steroidal anti-inflammatory drug has been available from the chemist called ibuprofen. And this gives us some reason for concern, because a lot of patients find it rather bewildering. They might very well get a prescription for an anti-arthritis medication from their doctor, and then can go to a chemist and buy another anti-arthritis medication. And the problem is, if you take the two together, you're much more likely to get side effects. And so it's very important for the patient to know that if they're receiving a prescription from their doctor, they must be very careful about what they buy over the counter. Hopefully the chemist himself will explain this to the patient. But we can see difficulties, and so there is this concern about this area.
Right. Now, another question that has cropped up. Is there any use, in your opinion, in taking some of these unusual remedies, such as muscle extract, vitamins, this kind of thing?
This is a question that everybody has, and many of the patients are embarrassed about asking. And I think it is such an important question because I know it's always in the back of their mind. They want to know about diet. They want to know about the magic cures they read about yesterday in the newspaper. They all have family members and friends who told them about this and that. And I think we need to discuss it with the patient. We need to tell them that in large part there is no evidence that diet, that vitamins, that some of these more exotic remedies, such as the one you mentioned, the muscle extract, there's almost no evidence that any of these things work. Now, if I may just go on for a moment, my approach with the patient is, if it's something like diet, and the patient tells me that eating cabbages every day, twice a day, is good for their joints, then I would be an idiot if I tried to tell them cabbages aren't good for your joints, don't eat cabbages. So I will often find out if they're doing something which they believe in, and it's simple, and it's safe, and above all it's not expensive, and not difficult to follow, then absolutely fine. The same about the copper bracelet, if you like. I don't think you'll find many doctors believing in copper bracelets, but the last thing I would do is suggest to the patient that they take the copper bracelet off. If they enjoy wearing it, that's fine. There are certain self-medication practices that we do try and rid the patient of, either because they're expensive or because they can be dangerous. And there are certain herbal remedies and certain forms of, particularly coming from the Orient, Chinese herbs and so on, which include not just a herb, but also very active chemicals. And so we will warn patients about self-medication, because you can't always be sure what's in the package, and you can't be sure that everything in the package is safe. We also need to talk about acupuncture and all the other forms of alternative medicine. And again, I think with that, we do need to tell the patients that there are no evidence, no data supporting use of these sort of remedies. They have been looked at. We're beginning to take these situations seriously because that's one of our jobs, and some forms of alternative medicine have been studied in great detail, and we now know very well that they do not have any specific anti-arthritic property. So, in general, the more the patient understands the condition and the more insight they have, I think the less time and energy they will spend with alternatives.
You seem to imply that there should be no fear for arthritic sufferers.
That's right. I think that fear really is an expression of the unknown. Patients will always worry, quite naturally, that they're going to end up in a wheelchair. Nothing is worse than coming to a specialty unit in a hospital, seeing people in a wheelchair, and the patients think that they too will end up like that. And that is why I've stressed there are over 200 forms of arthritis. Very few cripple. And even the so-called crippling forms of arthritis, most people live very comfortably with those forms of arthritis because there's so much that can now be done by the medical profession, by the ancillary staff, the nurses, the physiotherapists, the hydrotherapists, and so on.
Right. Well, as a last question, in a sense, as a sufferer from arthritis, where could I go to obtain more information?
Well, there's lots of places. Obviously, the first stop is the general practitioner. Then, if the general practitioner needs to refer the patient to the hospital specialist, there the patient would come across not just the specialist, who would be able to give further information, but all the other people working in the arthritis team. That would, of course, be the nurses who specialize in arthritis, the physiotherapists, the hydrotherapists, and all the other remedial therapists who have a great deal of information, quite a lot of time to educate the patient, to explain what is going on. And then, of course, there are some excellent lay societies, such as Arthritis Care itself, which is in a first-class position to direct the patient towards the appropriate literature and will tell the patient where to get further information.
Right. Well, thank you, Andrei, very much indeed. And a message of hope then from Dr. Andrei Calin. Thank you. Thank you, Andrei.
Thank you, Barbara.
So, remember, if you or someone you know suffers from arthritis, you are not alone. Now, Arthritis Care is an organization that has been set up to help you. Apart from supplying booklets and advice on a wide range of matters, they have local meetings organized by over 350 branches throughout Britain. To find out which branch is nearest to you, write to their headquarters at 6 Grosvenor Crescent, London, SW1X 7ER. I'll repeat that. 6 Grosvenor Crescent, London, SW1X 7ER. But if you have other questions, go and see your own doctor. He's an expert in your condition and will only prescribe what is best for you.
Well, you would need to know that since this interview was done, the details have changed. For a start, there's an email site which is info@arthritiscare, which is all one word, .org.uk. info@arthritiscare.org.uk. And the postal address has changed to Arthritis Care, Floor 4, Linen Court, 10 East Street, London, N1 6AD. I'll give you that again. Arthritis Care, Floor 4, Linen Court, 10 East Street, London, N1 6AD. And the email address again, info@arthritiscare.org.uk. You can, of course, have a look on their own page. Just put in Arthritis Care and you'll find your way there.